My aim with this really is just to give you an understanding of where this product fits in and how I would work with this type of product if we're using a product like the QuickMove. Now for me, as I spoke to you earlier on, I'm going to take a seat for a second myself. If I've got somebody who has that power, balance and stamina, and they're working with the return really well, that is great, and that's brilliant. And it may just be the key reason that we need the return is because maybe they are challenged with their own mobility. Yeah, I can move the return. Put it over this way. So it may be that the key reason for using the return then is so that we can do that transfer, and it's more about their mobility because maybe they can't mobilize. So when I'm starting to look at the power, balance and stamina aspect, if I've got somebody who is struggling with that stamina part of this is when I may then start to look at an alternative type of product. Now, as you saw with Trish just now, she could just lean back into the return belt for a few seconds just to get her breath and then come back into standing again. But if we're doing a transfer with her, we want her sort of in as good a position as we possibly can. And also then if she gets too tired and she then can't come back into standing for us that easily, that means then we could potentially have a little bit of a problem because we need to get her forward and then get the belt up and undone. So when we're looking at somebody whose stamina is not that great, then this is when I would start looking at working with this particular product. So I can use it to do a sit to stand with somebody, but it means now that they can actually sit down on the seat paddles rather than actually having to maintain that stand for any length of time. And I will talk you through the product in a moment. When I did this with a webinar weeks ago, or months ago, I think it is now, we very much looked at a sort of a case study that we did with this, where we had a therapy team who, the gentleman, I'm going to call him Arthur, 72 years old. He could do a sit to stand fairly well, but not all of the time. Sometimes he needed a little bit of assistance. So sometimes he could do it with one person with a bit of assistance. Sometimes he needed two people as well. So there were two carers going into this gentleman. He had had a fall previously. He'd had an MI. His confidence was not great because of the fall that he'd had. But the aim of the therapy team when we went in to see him, it wasn't me, it was one of my colleagues actually, their overall aim was to try and reduce the care package down from 2 to 1. But the main transfers were in his bedroom. That's where he spent most of his time in his bedroom. He had an ensuite bathroom, and so it was getting from his chair in his bedroom to his toilet. There was no way was he going to use a commode. Absolutely, definitely not. So initially they were starting to look at the return. But the challenge was, and the key thing as to why the return was not the right product for him, was because when they were doing the sit to stand from the toilet back into standing to do his personal care and then get his trousers back up and hope that he can stand for that length of time while he was doing that, was actually quite tiring for him. By the time he'd done the sit to stand from his chair, back across into the bathroom, sitting down and then having to stand up again, but maintain that stand for a period of time just wasn't working. So what we did is we used the QuickMove instead, and the impact of that was huge. It just meant that he could sit down, he could do his stand from the toilet, he could sit back down on the seat, get his breath for a moment, stand back up again, or just a little bit while they did his personal care, take a seat, and then just stand a little bit while they pulled his trousers up for him. And it made it so much easier for him. And he felt more secure because he was sat down and he was doing a little transfer. I would say it was probably around about 20 feet or so, maybe from the chair into where he needed to get into the room, into the bathroom. So it wasn't long, no threshold at all either, but the fact that he was able to sit down made a big difference. Now, also, part of that was down to what happens with this product, because there are a couple of things that I want to show you. One is, this is the seat paddle here. A squeaky seat paddle here. Now, if you imagine, if I'm getting somebody up and into standing from the chair, and then they come up inside of the frame here, to then put these paddles back down could be really quite tricky, especially if I haven't got somebody who's able to fully extend into standing. So you would end up catching their hips or catching their bottom when you're trying to put them down. So what we do with this and how we work with this actually is, yes, they will do that. But what we do is actually, if I push up underneath the paddle here, what you'll see happens is if I push up here, it will actually then swing away. So I can do that. I can push it up this way if I need to get it out of the way, and then in position here. Then I can have this back down. The beauty now is that when my client is coming up and into standing, lots of space to come into standing, but then actually when they come, I can then just swing these back into position so that they can then sit back down. And that removes this issue that you can get where they're sort of hitting their hips and you can't quite get them back into position. So part number one. And that worked really well for Arthur. The second part of this is this bar here. So the black bar at the top, this is normally where somebody would hold on if they're doing the sit to stand. This part is where I would hold on if I am the carer working with somebody. I'd be holding on like this, they'd be holding on here. We'll show you this in a minute, and Trish will come back in and we'll do a sit to stand with this. The other aspect of this bar at the bottom, or the other part, this little bar at the bottom has a completely different function. I want to try and get this into an angle where you can see this quite nicely on the screen. So what this bar does, I want you to try and imagine that I've got somebody coming up into standing, and we'll do this with Trish in a minute. But if I depress this bar here, I want you to just watch what happens to the seat paddles. So as I press this bar, nothing happens. Let me try again. Let's try from the back. If I press the bar, you can see what happens now, how actually the seat rises behind. So the idea behind this is that when you press that bar, when the person's coming up and into standing, it means that it follows behind them, which is really nice because actually they might not be able to go into that full stand right away. So you can graduate somebody through the phases of standing, and then once they become a little bit perched, it then becomes a lot easier for them to restand again. So when we were working with Arthur, having him in a sort of perched position, once he'd come up from the toilet, sat down on a perched position, so much easier to come back into standing again from this position than this position here when you are sort of sat right down, because it takes much more effort to do so. So this is designed to follow somebody up and into standing. It is not designed to be able to push down and bring somebody into standing though, okay? We really do use this just to sort of guide people through those phases so that they get into a nice perched position, so that when they have to do that restand again, or they need to sit down, restanding again becomes a little bit easier for them. It's quite a nice function. The other part of this is the knee pad, shin pad. You have in this, you have depth adjustment. So you can bring this right in, out, achieve a nice 90 degree angle on the person for sitting to stand, and then you also have up and down also. So you've got quite a lot of adjustment here. The other thing that we do have with the QuickMove, which I will show you, I have to do it from this side because otherwise you won't see, but the foot plate here actually comes off. So if I take this off, you'll be able to see. And then if I swing this around, you'll see a bit more. Where would we use this? We do use this sometimes where we are progressing somebody and trying to get them back into standing again and maybe mobilizing. So the challenge with all of these stand assistive devices is that you end up on a platform. And so then if we want to get the person walking and mobilizing, it becomes a little bit challenging because you can't get them to stand off the platform. So one of the things that we will do with the QuickMove, if we're really looking at the rehab perspective and getting somebody mobilizing again, is that we can use it to do a sit to stand with them, even to get them standing on the floor. We can do it this way, working without the foot plate, which might be something we may just gradually do a bit at a time or a couple of times a day. But then once we would do that, this though is not designed to be a walking frame. Once they're up and standing, we would have their frame beside us. We would move this out of the way and bring their frame in, and then they would be able to go and mobilize. So it's something that we use like this occasionally. It's probably used a lot more like this in acute environments, nursing homes, residential care homes, the likes, because it just means that they get a lot more scope out of the product. I don't think you'd put this in solely for that purpose, just for one individual, but you never know, because people's levels of ability fluctuate, don't they? You know, and sometimes they can do that up and stand and walking, and maybe sometimes they can't. Maybe they can do that stand, but the mobilizing they just can't do. So, you know, there is a point in note that maybe this would work for that type of individual too. Okay, I've talked enough. Let's get Trish back into the frame, literally into the frame. Okay, so if I just pulled the lead on my mic, am I okay? Yeah. Okay, yeah, take a seat, Trish, thank you. And I'm just going to put this back down. Boom, 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 boom. Normally with the person's weight, and you'll see in a moment how this works. Now, opening and closing the legs is done just simply by the bar at the back. So I would bring this in, remove my plates out, my seat paddles out of the way before bringing this into Trish, and get Trish to put her feet onto the foot plate. Looks like for me I'm not going to adjust this yet, because we'll see what happens, and we'll look at that in a moment. So what's the next thing I need to make sure? Have a look at Trish and see. So what we need to do is get her forward, right? So that position in the chair, again, she needs to come forward in the chair. So I'll get people to hold on to the frame here, and Trish can use this to lean forward and shuffle forward in the chair. Just keep coming, Trish, for me. Good. Perfect. Okay, good. Now she's in a good position. So now I can apply my brakes. Now then, I can adjust my support on the knee, bring it in, and just lower it down a little bit first of all. Get it into a good position, and then just adjust the depth so that we get a good supportive pad for her to do her stand. Okay, now when I was talking about the return, I mentioned about sometimes holding on a bit high can actually have that bit where you almost are pulling yourself up into standing. So something that I will do with this on occasions, and that you might be able to see this as I do this, if I pull this bar up, it will actually lower this handle down a little bit as well. So by pulling that lever up, I can lower how high this bar is, because it takes the whole thing up. So that's great, because that can really help somebody come into a stand, a good stand. Challenge though is they'll have to stand up a little bit higher to allow me to get the seat position back in. So this might work really well for some people, but they do need to be able to extend quite well into standing for you to get those paddles in. We'll have a look at that in a moment. So that's something that I will use occasionally, just by adjusting that if I think somebody's having to reach up a bit too high. You'll normally find it's those that are a little bit shorter in stature. I don't know if I'm going to be able to get this back down. I will. That has the biggest impact on. Okay, so for the carer's perspective, usually I would be back here, so holding on in this position, so providing some counterbalance on the unit, or equally we can be in position beside Trish this way, very much like I worked with the return, where I can be in here, hand on the unit here, I'm in beside here, so if I need to do my assisted sit to stand. Are you feeling comfortable? Your feet comfy to come in? Okay, so we're just going to go ready, steady, forward and stand. So she comes up, I make sure she's comfortable, stable. I can then come in, move my seat paddle into position, and then just get Trish to come back and down and into sitting. So actually I'll keep it here for a minute. What we can then do though is we can say, right, Trish, could you try and just stand a little bit? Don't try and come all the way up, but just stand a little bit for me, and then I can follow her, and then you can go back down into sitting. So this is where now we can use the unit to actually just graduate her stand. And then if you come back up again for me, good, and then sit. And now she's in a really nice perched position, which means then if we need to do further standing, she's going to find it a lot easier to complete that stand. And we work with this a lot like this, because it just takes away a lot of the effort for the individual. And you know, when you think about it, when you think about single-handed care as well, the more we can enable somebody to do things for themselves or complete the task by themselves by giving them these little teeny bits of support that will allow them to do that, the better the chance is that we'll be able to maintain that as a single care package, rather than having two carers coming in, one on either side, trying to lift her back into standing because she's struggling from that stamina aspect. Good. Okay, Trish, I'm just going to... The other thing actually I can just show you, as Trish is sat on this right now, if I hold this bar, it'll then just lower back down. So then if Trish comes back up into standing a little bit for me, I can remove these out of the way, that side and this side, and then you can go back down into sitting, Trish. Super. Great. QuickMove. A nice product. I think for me, this type of product really filled a gap where once upon a time people were going from stand assistive devices such as the return or patient turner straight into stand aids. Now we can keep people independent a lot longer working with equipment like this. And it may be that she may regress into having to use a stand aid. It may be though that we go the opposite way and she can actually maybe start mobilising and walking again as well. So that will be the upside of that for sure. Good. Any questions?